Hi all, Dr. Tod Anderson here. The information in this memoir is based on my personal experience as a licensed dentist and former tech professional. It is intended for educational and informational purposes only and is not a substitute for professional dental advice, diagnosis, or treatment. Always consult with your own dentist or qualified healthcare provider regarding any dental condition or treatment. The views expressed are my own and do not represent any employer, organization, or institution. Preface to my memoir, A Dentist's Journey to Affordable Dental Care. In 2019, I launched www.curateddental.com as a way to blend my passion for technology with my commitment to patient advocacy. I never set out to become a dentist. I didn't grow up in a dental family or dream of owning a practice. My roots were in tech, Silicon Valley during the early days of the internet. Dentistry came later, a career pivot made in my 30s. And what a pivot it was. This memoir isn't a self-help book or a how-to guide. It's a reflection, a candid look at what I've experienced and observed in over 17 years as a dentist. I've seen the good and the bad. I've had to shut down a practice. I've been buried under hundreds of thousands in debt. I've also built a platform I believe in, Curated Dental, to help patients navigate a broken system. I wrote this memoir because I believe patients deserve more honesty. They deserve to know why dental care is so expensive, why treatment plans vary wildly, and why dental insurance rarely delivers what it promises. They deserve to be empowered. This book is for anyone who has ever left the dental office feeling uncertain, overbilled, or brushed aside. It's for people who want to take back some control, learn how to advocate for themselves, and understand how oral care can be better. Dedication. I dedicate this memoir to my amazing wife and two beautiful children who have been my strength and motivation through every challenge. And I dedicate it to Dr. Jerry Novick, and his son Jerry passed away recently and was instrumental in my path to dental school. He believed in me before I believed in myself. His friendship and mentorship changed the course of my life. This book would not exist without his early encouragement and support. Thank you, Dr. Novick. Dr. Tod Anderson. Chapter 1, Introduction. Let's dive into this memoir. I've been a practicing dentist for over 17 years, but my journey into dentistry started in a very unexpected place, Silicon Valley. This memoir isn't a how-to book. It's a reflection, a look back on what I've learned, what I've struggled with, and what I think needs to change in dentistry. Let's be real, navigating dental care in the US is a mess. Rising costs, confusing insurance, wildly different treatment plans depending on the office you visit. Most patients are left frustrated, confused, or broke. I've seen all sides. I've built a dental practice. I've shut one down. And I've lived through the financial stress of hundreds of thousands in student and business loan debt. Before I ever touched a dental drill, I worked in tech. I was deep in the early days of the internet, building e-commerce systems, working on SaaS tools, and exploring encryption technology at Cambridge. When I pivoted into dentistry in my 30s, I was stunned by how behind the industry was. Paper charts, fax machines, lack of transparency, very little technology being used to actually help patients. That disconnect lit a fire in me. I didn't want to just treat teeth, I wanted to rethink how we deliver care. In 2019, I launched Curated Dental. It's an online platform that helps patients find high-quality oral care products, get second opinions, and now use AI tools to track their oral health. We're not trying to replace dentists. We're here to give patients tools to better understand their own oral health, ask better questions, and avoid unnecessary costs. The US dental system is broken. Dental insurance doesn't cover what people think it does. Treatment plans are all over the map. And preventive care is undervalued even though it saves money and prevents pain. Dentists aren't immune either. Most are drowning in overhead, debt, and shrinking insurance reimbursements. It's a system that's hard on everyone. If you've ever walked out of a dental appointment feeling unsure, overcharged, or like you didn't get the full story, this video series and this memoir is for you. My goal is to give you insight, options, and hope. You deserve better, and dental care can be better. Let's start changing that, one smile at a time. Chapter 2, The Costly Journey of Becoming a Dentist. Becoming a dentist isn't just hard, it's expensive. And most people, including patients, have no idea how costly and risky this path really is. After earning my degree in biopsychology from UCSB, I worked in tech. But when I chose to leave that world and pursue dentistry, I was stepping into a new profession with zero family background in it, no connections, no backup plan. Just a massive leap into a field I hoped would offer more control and more meaning. Dental school itself is 4 years long, not including undergrad. And it's not just time intensive, it's financially crushing. I racked up over $450,000 in student loan debt just to get trained. That number still haunts me. What's worse is that many of us graduate with no real business education. Yet most dentists are expected to open or run a practice. So we either buy an existing practice with a business loan or we start from scratch, often with no real guidance. In my case, I ended up taking out over $500,000 in business loans on top of my student debt. That's nearly $1 million in debt to be your own boss. And for many of us, the math just doesn't work out. Running a dental office isn't cheap. Rent, staff, equipment, supplies, insurance, marketing, software, the list never ends. And dental insurance companies often reimburse us far less than what procedures actually cost. So to survive, we're pushed to see more patients, work longer hours, and produce more just to stay afloat. It's no wonder burnout is so common in dentistry. The public sees us as wealthy professionals, but the reality is that many dentists are drowning in debt and struggling to break even. And this financial pressure isn't just hard on us, it affects patients too. Offices might push treatment that isn't truly necessary or overbook schedules to boost revenue. It creates a system where no one really wins. That's why I believe it's time to talk openly about the real costs of becoming and staying a dentist. If we want a better dental system, we have to start with the truth. Because if we can fix how dentists are trained and supported, we can build a system that's better for everyone. Chapter 3, the inconsistency of treatment plans. One of the biggest frustrations patients face is how inconsistent dental treatment plans can be. You can see 3 different dentists for the same problem and walk out with 3 completely different recommendations and 3 wildly different price tags. That's not just confusing, it's alarming. Dentistry has a lot of gray area. We don't always have one correct way to treat an issue. There's judgment involved, but here's the problem. When you mix in financial pressures, limited insurance coverage, and different training backgrounds, the gap between what dentists recommend can get pretty wide. Let me give you a real example. A patient walks in with a cracked molar. One dentist says it needs a crown. Another says it needs a root canal and crown. A third says pull it and get an implant. That's a $1,200 decision versus a $5,000 one, depending on which chair you're sitting in. Are any of them wrong? Not always. But for the patient, it's incredibly hard to know what's really necessary and what's possibly excessive. As dentists, we all bring our own experience, training, and business models into the room. Some offices are fee-for-service. Others rely heavily on insurance reimbursement. Some have quotas or production targets. And those things can absolutely influence treatment recommendations. This inconsistency damages trust. Patients start to feel like they're being upsold instead of cared for. And the truth is, most dentists aren't trying to scam anyone. They're just trying to survive in a system that doesn't reward prevention, doesn't pay fairly, and leaves a lot of judgment calls up to interpretation. What's the solution? In my view, it starts with transparency and education. Patients deserve second opinions. They deserve to see their x-rays and have things explained clearly. And they deserve to know that it's okay to ask questions, compare plans, and even walk away. At Curated Dental, we built tools to help with that. Our AI-based second opinion platform lets patients upload their treatment plans and radiographs and get an independent review without the pressure of sitting in a dental chair. Inconsistent treatment planning isn't going away overnight, but with more transparency, better communication, and new tools, we can help patients navigate it with more confidence and less fear. And that's a big step in the right direction. Chapter 4, Dental Insurance Realities. If there's one thing that frustrates both patients and dentists equally, it's dental insurance. On the surface, it sounds like a great benefit, but once you start using it, you realize how limited and confusing it really is. First, let's talk about the annual maximum. Most plans cap out at around $1,500 a year. That might have been useful in the 1980s. Today, it doesn't even cover one crown. That's not insurance, that's a discount plan with a cap. Then there are waiting periods. Some plans make you wait 6 to 12 months before they'll pay for anything major. Imagine needing a root canal now, but being told you have to wait until next year. There's also the fee schedule game. Insurance companies set the prices they'll pay for procedures, and many of those don't reflect what it actually costs a dental office to deliver care. Dentists end up taking a financial hit or have to pass costs to the patient. And let's not forget virtual credit card reimbursements. Some insurance companies pay dental offices through third-party cards that include processing fees, taking even more away from the practice. What does all this mean for patients? Delays, denials, unexpected bills, confusion. A lot of people think their insurance will cover everything, and it rarely does. The fine print is full of exclusions, waiting periods, and loopholes. From the dentist's side, we spend hours fighting for approvals, submitting extra documentation, and appealing denials. It takes time away from actual care, and it's emotionally draining. And the saddest part? Many people don't go to the dentist at all if they lose their insurance. They think they can't afford it, but in reality, a cleaning out of pocket might cost $100. Ignoring it can lead to a $2,000 problem down the line. Dental insurance isn't like medical insurance. It doesn't protect you from catastrophic costs. It often just offsets a small portion of your care and makes everything harder in the process. At Curated Dental, we help patients get the most out of their benefits, but we also educate them on how to prioritize care, find honest providers, and know when insurance may not be worth the hassle. The bottom line? Don't let your insurance dictate your care. Use it when it helps. Skip it when it doesn't. And always ask questions. Because in today's system, the only one looking out for your best interests is you. Conclusion, a better path forward. If you've made it this far, thank you. This memoir wasn't written to complain, it was written to inform, to shed light on what's happening behind the scenes in dentistry and to show that there's a better way. I've made mistakes. I've failed. I've also learned, rebuilt, and kept pushing forward. Because I believe that dental care should be honest, affordable, and accessible to everyone. Whether you're a patient confused by a treatment plan, someone without insurance trying to stay healthy, or just a parent looking for the right toothbrush for your kid, Curated Dental is here for you. We're building tools, sharing knowledge, and creating a community where your oral health matters, not just to your dentist, but to you. So visit us at www.curateddental.com, explore our oral care products, get a second opinion. Track your treatment with our upcoming tools, or just shoot us a message. We'll be there. Let's stop accepting a broken system. Let's build a better one. Thanks again for listening.